Hello and welcome to our fourth webinar in the Cannabinoid Conundrums webinar series. Today's webinar will be presented by Dr. Michelle Peace, an Associate Professor for the FEPAC Accredited Department of Forensic Science at Virginia Commonwealth University. Without further delay, here is Dr. Peace.
Thank you so much for having me participate in your series. I think this is not only a really interesting topic, but also a really important topic for all of us to have cross-sector conversations about the impact of cannabis in our culture, on our society, and in our population. So again, I appreciate being part of your series. I'm fortunate to be funded by the National Institute of Justice. I've been funded since 2014. We have been evaluating how electronic cigarettes impact public safety. And so, the question originally was, how are devices manipulated, and how are the e-liquids themselves, how are they being used to vape other substances? And of course, that has sent us down lots of really interesting paths. And I think not the least of which has been evaluating essentially the merging of the cannabis and the e-cigarette industry. And I'm going to talk about the timeline of both of the industries. And it's going to be part of my final conclusion in that it really takes cross conversations between multiple sectors to be better predictive about things that emerge in our culture that's going to impact public health and public safety. So one of the things that we do have an appreciation, understanding of, is that when you have good, strong, thorough, robust policy and regulations, the intention of that is to protect the public's health and their safety. So in the absence of policy and regulation, then mythology is going to develop in our cultures, in our societies, in populations that are going to be users from the industry. And then you're going to get quality assurance gaps. And when you have gaps in quality assurance, then people are going to be at risk for adverse events, and you're going to see deaths and injuries increase. So again, the reason we have policy and regulation is to protect the public. So I am going to start with the history of the electronic cigarette, because I do think the timelines are particularly important, and again, send a really strong message of we have to have more cross conversations, be more embedded in our communities, understand what is emerging, and be thoughtful about the evolution of products, of devices, so that we can better track these things. So the electronic cigarette was actually invented in 1927 and patented in 1930. And you can see here from that original patent, it looks much like a modern electronic cigarette. And these were not invented for the purposes of vaping nicotine. Tinctures were really popular at the time, and they were looking for other ways to consume those tinctures. If you fast forward into the mid-60s, big tobacco was keenly aware that scientists were producing data that demonstrate how tar and tobacco and nicotine can negatively impact health, and particularly generate cancerous tumors. And so in order to try to manage that, big tobacco did invent some version of an electronic cigarette. This was a heat not burn device. And you think about what was happening in the 60s, tobacco was still cool. And these devices were particularly difficult to use, and people didn't get the dose of nicotine that they really wanted. So the devices were a commercial failure, and so the products fell out of the marketplace. If you fast forward into the 90s, there are several pockets of academic researchers who are working on using the technology of this device to deliver pharmaceuticals. VCU Health, the Department of Pharmacology and Toxicology, was one of those. And the reason why I have VCU highlighted, in addition to some of the other universities, is that my collaborator, Justin Pokeless, was actually on the research team that was in pharmacology and toxicology at VCU. We've been able to leverage what he learned in the 90s about aerosol technologies. And so if you fast forward into the early 2000s, this is where we have really our modern understanding of the e-cigarette. So Han Lick is attributed to inventing the modern electronic cigarette. He sold his patent to big tobacco in China. And of course, that was quite lucrative for him. But what we know is that in 2003, the electronic cigarette made its way around the globe, coming to the United States essentially last. And so it entered into the marketplace through the Tobacco Expo, and where it won an award for novel products. And so this is the first press, the big press into the United States. It did not come out of big tobacco at this time. What we also have an understanding of is that because the electronic cigarette had made its way around the globe before it landed in the United States, two countries, New Zealand and Germany, had decided to adopt the electronic cigarette to essentially help their populations stop smoking a traditional cigarette. And so they made these decisions in the full understanding that there were not long-term longitudinal studies that demonstrated the long-term safety of these products. So still in the early 2000s, in the first decade, the U.S. Food and Drug Administration, they really tried to stop the importation of the electronic cigarette into the United States. And this is where we learned that the FDA, because of the nature of the language and their regulations of tobacco, the electronic cigarette didn't fall under those regulations. And so they had to spend some time changing those regulations, but they couldn't do so without the signing of some kind of directive from Congress and the president's office for them to be able to do that. Without those federal level regulations, the industry really was wide open. And so it wasn't until 2016 that the FDA was able to promulgate their regulations to control the electronic cigarette. So what we knew what was happening prior to those regulations emerging in 2016, individual states had to stand up their own statutes to govern the electronic cigarette. So prior to the states doing that, children had easy access to the devices, whether that was in a brick and mortar retail shop or online. We also know that states started developing legislation that dictated where you could vape. Most states had already put a ban on smoking in public, and so then they also instituted that people could not vape in public places like restaurants. So what we know in 2019 is that Congress passed legislation that you had to be 21 in order to purchase any kind of nicotine-containing substance. And then in 2020, President Trump essentially pushed forward a ban of flavoring chemicals in certain products. And this got very complicated in terms of the industry finding loopholes in the FDA regulations that they could still work in to put flavoring chemicals into these nicotine-based devices. So what I want to put a pin in the timeline on in the reference to cannabis is that I began thinking about the electronic cigarette in 2013 and trying to understand what the devices were and just really beginning the conversation around the devices could be used to vape other substances. And of course, we were funded shortly thereafter. So I want you to remember that part of the timeline. So in the gap with no regulations, the industry had a pretty broad space in terms of how they could market the devices. Now, because they were not FDA approved for smoking cessation, the industry turned towards these were lifestyle choices. So here we have, again, the first blush of, because they're lifestyle choices, then they can be used to potentially vape other things. Although that's not part of the marketing, when you're able to market that way, and that's what your message is, then it creates bandwidth for other applications. And so I think what's also interesting in this space is that even though they couldn't market that these were smoking cessation devices, Juul was able to get away with this marketing. They don't, state that this is a smoking cessation tool, but it's pretty clear that that's the message that they're sending, and that was approved. The other piece is that we know that kids had access to these, and there was a pretty strong effort to curb the industry from marketing to children. But that just meant that they found other ways to do it. So there was one company that actually had a point system set up for young people that they did their marketing for them. So if you bought a product, you got points towards a future purchase. If you used certain hashtags that tagged them with a picture of them using the device, then you got more points towards purchases. If you referred your friends, then you got more points to buying products. So the market just let the kids market it themselves because, again, these are lifestyle choices. So the FDA's regulations came out in 2016. They really didn't become enacted and for several more years. So the FDA had to, receive applications for products, and it just took a long time for those applications to roll in and for them to be evaluated. And then the market is still constantly changing, and so the FDA had to be responsive to that. So why do I care about nicotine in e-cigarettes? Well, I think this is all news that, we're really aware of, is that, for children, the use of nicotine, increases as they get older. And that we also know that children are vaping THC. So those two things we separately understand. But when you look at the relationship between those two things, I think this is a really interesting study out of North Carolina that was published in 2019, where they surveyed children. And so you'll see that the total sample was 2,835 kids. And so the question when asked, have you ever used an e-cigarette to vape cannabis? That was almost 10% of the kids had said yes. But when you break down the data, and I looked at the data a little bit differently in terms of the raw numbers. And so what I found was that if kids used a current cigarette, then 2.5% of those kids also vaped cannabis. If they used an e-cigarette for nicotine, they were 4.8% of those kids, of the total number of kids, used cannabis. So, I'm not overtly stating that there's a gateway drug here, but when we talk about first use of any kind of substance, then it creates pathways for kids to think about using other substances. And certainly, e-cigarettes have been, look like from this data, is a pathway for kids to move to other substances. There's been quite a few manuscripts emerge recently that connect cannabis and nicotine vaping trends. And so, one of the conclusions in one of the manuscripts was that traditional cigarettes saw no significant association with vaping cannabis, but if you vaped nicotine, then vaping cannabis trended upwards. So when we think about the products themselves, there is some move now to not consider what different generations of products are, because everything is wide open right now. I very much think about these in terms of generations of devices, generations of technologies, because each of them have their own important piece in the evolution of vaping other substances. So the first generation e-cigarette that was imported in the States was the Cigalike. It's disposable and could be recharged. Essentially, though, these were ones and dones. People wanted to be able to refill their devices. They wanted to be able to recharge their devices. We're in the land of recharging everything these days. So what was invented shortly thereafter was the vape pen that allowed users to recharge their devices and fill their device multiple times and with more volume of e-liquid. This gave way to a third generation called the mod box. These are refillable, they are rechargeable, they have larger battery packs on them. And so the larger battery packs allow the users also to choose what voltage or wattage they want to vape with the thought that higher voltages will put more drug into the aerosol cloud. And but these things are particularly bulky. So aside from the fact that they are completely customizable, these are problematic in terms of they don't really allow for discrete vaping. However, they weren't meant for discrete vaping. They were meant to allow the user to be able to fully customize their experience, from choosing the coil to the kind of wick that was used in addition to the e-liquid itself. So what is recognized as a fourth generation is the pod mod, right? So this started out as the Juul. These were meant for the discrete vaping of nicotine. They're usually small, hand size, easy to hide, and the device is easy to vape from and hide the aerosol cloud. And so I've always contended that there's a generation on the in-between, and this is called the dripper and the dab rig. So this generation emerged because people wanted to vape other substances. So what was happening is that because these coils get so hot, from depending on the device and the configuration, between 250 and 1,000 degrees Celsius, you can just drop your e-liquid or your drug of choice right onto the coils, and then an aerosol cloud would be generated. But you have to take the mouthpiece off, and either you have to put the mouthpiece back on or you use a straw to inhale it. So the thought was, well, why don't we just widen the mouthpiece? And that way you can drip your e-liquid or place your wax or dab directly onto the coil from there. What also emerged in this generation are ceramic cups and stainless steel cups for herbal products, for plant products, and waxes and dabs. So again, we've contended there's really 5 generations because we have to think about that, the drippers and the dab rigs. But what is really interesting for us is that when we think about these pod mods, of course, we think about the 5th generation in terms of nicotine delivery. We think about the Juul device. But in the timeline, what we really have is this generation was invented prior to the 4th generation dripper and dab rig. So with the nicotine generation evolving, we know that because it's discrete vaping, because it allows people to vape whenever and wherever they want, the construction of these became very, very clever. But again, this technology was invented prior to the 4th generation. So the question is, which came first in terms of the pod mod? So when you really look at now the evolution of the cannabis industry, Chris Volkerts, who is the CEO and founder of Granco Science, this is the company that is the home of Snoop Dogg's THC vape pen. He says that he tried THC in a vape in 2010, and that the device wasn't optimized for it. And he spent the next couple of years optimizing that. So he rolled his product out in 2012. And remember, I'm just now thinking about how do you use e-cigarettes to vape other substances, not until 2013. And so there's also another press from another angle in the cannabis space. There was a group of graduate students who were working on a device to, they had to essentially for class invent a product that would help humankind. And so they said smoking was an easy target. So they invented a version of an electronic cigarette. They tried to make the nicotine electronic cigarette a go, and they struggled with it because big tobacco really wasn't paying much attention to them, sort of laughed them out of the room. So they sold off their nicotine business and invented PAX. PAX was the first THC vape pen, heat not burn. And so PAX and Chris Folkert's products were rolled out in 2012 in Washington and Colorado, the year that adult use retail cannabis was legalized. And so after the commercial success of PAX, they rolled back and invented Juul. So in this situation, we don't have discrete vaping of nicotine because, kids wanted to secretly vape nicotine. It came out of the cannabis industry and the desire to discreetly vape THC. So it wasn't long after that emergence in 2012. We see here in 2015, this is out of the New York Times, in the health section of the New York Times, an editorial, "The device called a juju joint heralds a union that seems all but inevitable, marijuana and the e-cigarette together at last." So now we have this cultural bellwether that is the New York Times, stating, hey, it's here. We have an ability to vape other drugs in these devices. We have here Sarah Silverman. Again, this is, these cultural bellwethers that this is now acceptable. She's literally on the red carpet. She's being asked, what are you carrying in your handbag? So she pulls out her device on the red carpet. This was live TV. She pulls out her vape pen that has THC in it. She doesn't know what to call it. So she says, and this is my pot, because she didn't know what else to call it. So now we have rung the bell again that this is culturally acceptable. We're well inside now of adult use legalization nationwide. And so this really helped the cannabis industry take off. So let's back up and let's talk some science now. So when we think about the composition of the e-liquids for nicotine, the carriers are propylene glycol and vegetable glycerin, right? These are the humectants that help create that aerosol cloud. We know there are tens of thousands of flavoring chemicals that are used, and of course that there are all kinds of potential active ingredients in addition to nicotine. So my research group, tracks, monitors ethanol, other plant products besides cannabis, non-traditional pharmaceuticals, scheduled drugs, designer drugs, but we're going to be talking about cannabis e-liquids. In terms of the cannabis e-liquids, the carriers really have become polyethylene glycol and medium chain triglycerides. A lot of vaping products, frankly, are just wax dabs, so they're an incredibly high percentage of the THC concentrate itself. They're also putting flavorants in these pods as well, and we know that the phytocannabinoids and the synthetic cannabinoids are also put into these products. So again, we're back to PEG and MCTs as the carriers. This is because the cannabinoids are too lipophilic to dissolve in PG and VG. So, to the point that the e-liquids really are just waxes and dabs, there's some truth to that. And so in addition to them looking like e-liquids, remember that there are stainless steel cups that these products can be put in and then vaped. So let's talk about some quality assurance issues with these. There was a point in time in which Juul, there was a whistleblower inside of Juul who said, hey, we think that there's roughly there's a batch of Juul pods, about roughly 1 million that are contaminated. And the CEO of Juul did not recall those products. He said they don't know what they're vaping anyways. So this is where we have the industry has moved so quickly and the products are used so quickly, and because regulations are still fairly loose and there's no requirement that the products are labeled with their actual ingredients, people don't know what they're vaping. So he says, don't recall them. People don't know what they're vaping anyways. They did send off a selection of their devices to be tested after the whistleblower information came out. And the tests that they ran on these, at least from the data that I saw, there's no way they could tell in any way, shape, or form how or what was causing the contamination of these jewel pods. So we did start looking at CBD e-liquids in our lab, and we see here in the early products that we saw, right, the carriers are propylene glycol and vegetable glycerin. They're very low concentrated. Now they work twice what was on the bottle, but it's still very low concentrations. And again, that's because it doesn't really go into PG and VG that well. And so once we started seeing the CBD in medium chain triglycerides, this is where we really saw the concentrations of the cannabinoids increase. We do know that there is problems with quality assurance for any of the cannabis products in the unregulated industry. And so, this is what we have on the left here is the Liberty Reach. Now, we published this in 2016, which meant that somebody sent us the device probably in 2015, and we evaluated it. And of course, we saw that what was advertised and what the actual concentrations were two different things. And so there's been multiple groups who have been monitoring the accuracy of the cannabinoid products, and they're still all over the board in terms of consistency. One period in time, there was an effort to maybe put CBD in with nicotine. And so what you see here, this was actually a product that there was a clinical research project that was going to consider these. And so after we evaluated the products for them, they withdrew the clinical design. So what we see here is that the pods they're separated. So we see that one layer is MCTs with most of the CBD and some nicotine, and the PGVG layer has most of the nicotine and a little bit of CBD in it. So they pulled this clinical study. One of the things that we've also noticed is that the THC e-cigarettes have, over the course of a year, we don't know if this is chronological or, what the trend is here, but we do know that we have seen more complicated chemical profiles of THC e-cigarettes through time. We know that MCTs and vitamin E acetate has been banned in some states, and this largely came about because of EVALI in 2019, where a number of people developed significant lung injury and some people died, and some of those patients were found to have vaped product with vitamin E acetate in them. So we also have an appreciation that a lot of e-cigarette THC vapes with cannabis in them do have high concentrations of heavy metal in the aerosols. And so while this, in terms of how this correlates to what is in a nicotine vape, I'm not going to draw that correlation, but there is some concern that because there's so much heavy metal in some of the cannabis vapes, that actually accurately quantitating how much THC is in these products might be influenced by those metal particulates, not the least of which is that you're also inhaling those into your lung tissue. So let's move on to accidental poisonings. On that note, we know that in 2017, 2018, with the press of CBD and it being unregulated, there were regions in the country that seemed to have higher concentrations of people reporting adverse events from vaping CBD. We also know in the lead up to this that because the FDA essentially took so long to promulgate their regulations, and because we were seeing the increases of children accessing e-cigarettes, the FDA essentially got sued by some anti-tobacco groups, and the U.S. federal judge said in the summer of 2019, you have to push out your regulations. You have to implement them. These regulations, you have to stop sitting on them. So, and the FDA had their reasons, but what wound up happening just a couple of weeks after that is that we did have a handful of teenagers in the Milwaukee area go to the hospital with a severe lung damage. So the conclusion was that a lot of these cases were because people were vaping unregulated THC products, which contained vitamin E acetate. And so, it's hard to know whether or not these numbers dropped off because either people stopped looking or there was actually an actual decrease, but there were 2,800 hospitalizations and 68 deaths. And so I think one of the interesting things about this is that 14% of the people said that they just used nicotine. So not to discredit, I'm not discrediting that it was vitamin E or vitamin E acetate that was in these products, but lung injury does occur when you vape. And so, there's a couple of different mechanisms to this. And so, when you put chemicals into the alveoli and it exacerbates any kind of damage, or that thin layer of water is destroyed in whatever capacity, then that's going to create injury. And so it doesn't matter what the chemical is. And so if you get injury in the alveoli, then there is going to be this separation of your capillary bed from the alveoli itself, where there's going to be neutrophils come in. So we know that this is likely the mechanism for vitamin E, but this also applies to other drugs, or this also applies to other chemicals. So at the end of the day, we do know that there were many of the patients in that EVOLI epidemic who were found with vitamin E acetate in their bronchial lavage fluid as well. So there's some confirmation to that some of these patients were vaping the unregulated THC products that had vitamin E in them. But we do know that if you look in the literature prior to this, is that people had been reporting that they were having some problems and that was likely associated to vaping. They complained about having nose irritation and sneezing and airway irritation and hypersecretion of mucus. Some of this is because PG and VG itself are hygroscopic. They draw water to them. And your mucous membranes are flushed with water. Your deep lung tissue has a thin layer of water in there. And so if you're putting PG and VG in there, and it's going to be absorbing that water and becoming an irritant. So this was in the literature prior to EVOLI, and then of course has been exacerbated because of vaping THC. So with that said, we did ask, well, what else are people putting into their vapes? And this was a survey that we generated during COVID. And so we do see that the predominant drug that they claimed to vape was THC and CBD. Other cannabinoids were things like Delta 8, Delta 10, some of the other synthetic cannabinoids. I think part of what's interesting about this data is that if you look at those 12, you have 3 people who are vaping DMT. A lot of that are herbal remedies as well. We also asked, what do you vape in combination in the same e-cigarette? Like, what are you putting into your vapes? So you see where people were putting phenylpiracetam in with their CBD, methamphetamine into their CBD e-liquids, methamphetamine in their nicotine, but a lot of combinations with cannabinoids, generally speaking. And so we did ask for the context of their usage. So most people are vaping some kind of cannabinoid. And a lot of people admitted to vaping cannabinoids while driving. So, of course, we have some significant concern here with regards to public safety. We do monitor what's happening online. And so these are a couple of products that we purchased where there wasn't any information besides this is going to make you feel really good advertisement. And so what we found here was MDMB Fubinaca in these products, and you'll see there that there was so much drug in the products that they essentially fell out of solution and crusted up the bottom of the bottles. We received a product from a consumer who said that they admitted to vaping a lot of THC and smoking a lot of THC, and that they had purchased this product, Diamond CBD, and they said this wasn't weed. So they sent it to us, and in an effort to, since we don't know where or how he purchased the product, we went online and purchased directly from the manufacturer, directly from the factory where it was produced. That's important because what we found in those products that we randomly chose off of their website, 3 more products had 5-fluoro-ADB in it, and 1 product had dextromethorphan in it. So the CEO of the company said that they went back to look at the batch that we purchased from, and frankly, he wasn't able to do that. We secret shopped it, and so he now says he sends a sampling off of his production lines to be tested. Frankly, there's nowhere on that list as 5-fluoro-ADB and dextromethorphan, but he did admit that the products had melatonin in them. Well, still, that's not CBD. And so this really smacks of, in the unregulated cannabis industry, consumers do not know what they are taking. So we did publish that data, and it came out. A reporter from the Philadelphia Inquirer tracked us down and took that report to the CEO of Diamond CBD. And so after the report came out in the Philadelphia Inquirer, we were in popular media. And so what fell out of the popular media push was that people started sending us their products saying, I had an adverse reaction. And so these products don't look sketchy. They don't look like those bottles that the MDMB was in. These look like legitimate products. And so these are some of the stories, where people reported that they had really horrific adverse reactions. So in the early days, we did see synthetic cannabinoids like 5-fluoro-ADB. But in the more recent years, we saw adverse reactions happening with people who were taking phytocannabinoids. And so what we found in these situations is that for the most part, they were naive users, and these products they were highly concentrated, way above what was on the product label. So we do have an understanding of the impact of the Farm Bill. And one of those impacts is that there was an overproduction of CBD. And so with that overproduction of CBD and with all of that sitting in the market, worth potentially millions of dollars, and with the legalization of Delta-9 THC as it spreads through the states, manufacturers are not going to leave that CBD sitting in those vats unused. So with acid and in time, that will convert to a mixture of Delta-8 and Delta-9. So those products entered the marketplace and was sold as hemp derived with this air of safety. So what we saw after Delta-8 emerged is that because these lab created cannabinoids are reasonably easy to manufacture, we saw lots of different kinds of derivatives and isomers emerge after Delta-8, and not the least of which were the acetate derivatives. And so we started tracking these products. And so this is just a sampling of some of the data that we have. And I'm going to break this slide down for you. So the products in the box, the Gorilla Glue, for instance, was marketed as having contained HHC. And so in that product, we also found CBN and CBG. But if you look at Hawaiian Sunrise, marketed to contain HHC, it also contained all of those other cannabinoids. And you look at Super Silver Haze, marketed only to have HHC, also had all of those other cannabinoids in it. You move down to the next subset. These products were marketed as containing HHCO, and then we also found other cannabinoids in those. And these products were marketed as containing THCH, didn't have any THCH in them, but we found all of these other cannabinoids in them. So this really does tell the story that these products with an air of legality, people don't know what they are consuming when they buy those. And the risk of an adverse reaction can be significantly high, depending. This is one company who has decided to embrace and celebrate the fact that their products are mixtures. And so they actually claim that, this is more of a boutique experience for them. So they're right out front that this has multiple cannabinoids in them. Some of them are going to be early onset, some are going to be late onset. So again, we've got some challenge here that, well, okay, now we're just out front with it, but we don't know what the potency and the efficacy are of any of those cannabinoids. So again, the risk for an adverse event is fairly high. So with all of that, of course, is how do you analyze all of these? And also particularly in a particularly rapidly evolving market where a new cannabinoid seems to come out every week or so. And so we have had to do a lot of work. We've had to find new transition ions that actually are unique to certain compounds. And this is an incredible amount of work to try to stay ahead of the marketplace. Well, frankly, we're not ahead of the marketplace. We're always trailing. But how do we generate this methodology to get that into the hands of operational practitioner labs? So we're in a position of we don't know what is coming when, so we're always playing catch up. And so we have to have strategies and collaborations in different sectors so that we at least will be less surprised about what is going to happen in our communities. So intelligence does exist in certain spaces. So how do we move out of our own silos and have better conversations? Education is desperately needed in our communities, and we have to have some urgency in generating that education so that we can close these public health and public safety gaps. The industry is able to generate their own narrative, and they are way out in front in terms of how they communicate that. And then, of course, in our own sector, I do believe it is really important that we adequately and properly attribute the cause of an impairment or an adverse event. And, some of that is because I do believe that the unregulated industry creates an incredible amount of shade and question on a regulated industry. It complicates, developing a strong policy. And so when we understand what an impairment or a poisoning or a death is due to, then we know where we can better focus our efforts and how to focus those efforts. So on that note, huge thanks to RTI and to the National Institute of Justice for all of your support. Thank you for including me in your series here. I have a giant team of collaborators at VCU. Allison Breland and Caroline Cobb have definitely helped me with many of our ongoing products. Justin Pokless has been a consistent collaborator since the beginning of the e-cigarette research, so huge thanks to him. A lot of the data that you have seen is really because I have a really great army of students, and you see my research team every year can be fairly big, but a lot of the data and a lot of the initiative right now is due to my doctoral student, Elena Holt. And so on that note, I am very, very happy to take questions. So thank you again.
Hello, I'm Dr. Ruth Winokur, a principal scientist with the Center for Forensic Science Advancement and Application at RTI International. Thank you, Dr. Peace, for providing such an informative presentation. We will now begin the Q&A session. We have quite a few questions concerning the rigs or the devices. So hopefully you'll be able to answer more than one of those just by the asking. But you mentioned a merging of the industries, but the actual hardware itself was designed for e-cig tobacco products before they were ever filled with cannabis extracts. How can they merge if they were always the same technology?
Well, definitely thank you for the opportunity to respond. I think one of the interesting things about electronic cigarette technology is that it wasn't developed for nicotine. You know, the e-cigarette was invented in 1927 for non-nicotine use. And so, you know, when I talk about the merging of the industries, really we're talking about how one industry co-opted the technology of another industry. And so, you know, we have to, you know, develop an appreciation for the fact that this technology can be used to vape a myriad of drugs. And so there's a lot of really good research that is happening now in terms of how do you leverage this technology to deliver other drugs besides what we're used to seeing about nicotine and THC.
Great. The next question, I'm not entirely sure what they're getting at, but I'm going to assume they're talking about the materials that would go in the e-cigarettes here. But can the government do anything to ensure what is ordered/imported by U.S. companies is what they actually get in reference to material safety or ISO compliance standards?
Yeah. Again, thank you for that question. It is a really good question and a very timely question. I think it came out in the news just today that there are thousands of products being imported that are not compliant with FDA regulations. And so, as is the case with most regulations, you know, enforcement is always the issue. And so, you know, there needs to be, you know, some resources provided for those regulations to be enforced. So, you know, we're in conversations with at least one group that is wants us to take a look at products they know are being imported and suspect are not compliant with the current FDA regulations. So we're going to be pursuing some of that soon.
So, okay. The next question is about the different generations. I'm pretty sure you went over this, but just to clarify for this questioner, so all dab rigs are the same generation. A 10-plus-year-old Bell dish design pre-dab nail is the same as a new dab rig using an e-nail. So,
yeah, I mean, we put, you know, drippers and dab rigs into the same category as they pertain to these pen-like devices that are being used to consume, you know, waxes and dabs. So if they are pen-like and they are, look like an e-cigarette, and a lot of them do, then we've pushed them together into a generation because they emerged around the same time. But that, I mean, to the point that, you know, can you just use, you know, a nail? Yeah, of course, absolutely. But that doesn't look like an electronic cigarette. And so there's still some co-opting of the technology there because that technology is acceptable and allows for, you know, easy transport. So yeah, to the point that, yeah, people still use all kinds of other technologies to consume these substances.
Okay, great. We do have a couple of comments, but I'm going to save those for your comment until last and just go with the questions for now.
Okay.
How similar is EVALI to lipid pneumonia? They both involve oils getting into the lungs where it doesn't belong.
Yeah, so EVALI just stands for, you know, e-cigarette and vaping associated lung injury. And so really early on, what you know, the really good scientists at the CDC and the FDA and a handful of other academic researchers, you know, saw that a lot of the patients had developed lipid pneumonia, for lack of a better way to describe what was happening physiologically with some of these patients. So definitely some of the patients, some of the people that experienced EVALI and died from EVALI, you know, definitely developed and got pinned with a diagnosis of lipid pneumonia.
Great. Thank you for that explanation. So the next one is, I have started to see many cases of people passing out, complaints of dizziness and vomiting from use of THC devices. Is this something that's common?
Well, I don't know that we can say that it's common. I think what we don't know is what the prevalence is. We have seen a rash. We have seen an uptick in the number of incidents and complaints, particularly in our poison control centers, of people who are reporting those very symptoms, plus a whole cache of other symptoms. And these are largely attributed to high concentration THC products. What we also are having a growing appreciation for is that some of these adverse events are also attributed to people who are naive cannabis users. So those are two categories, and likely the third category is we're also seeing some evidence that some of these cannabis products that are creating adverse events are from these lab-created THC isomers and derivatives, all of these new synthetic cannabinoids that are in the marketplace. So we're really seeing where I made the point in my conclusion that proper attribution as to why somebody is having an adverse event is, I think, really important, because some of the adverse events aren't necessarily due to Delta-9 tetrahydrocannabinol. They could be due to something else, or maybe somebody's having some kind of drug-drug interaction that they've not told their physician that they're consuming cannabis or want to consume cannabis, and so we don't know what the adverse events are due to, but we are seeing an uptick. Like, there's an alarming number of people who are reporting to poison control centers that they're having significant adverse events from cannabis products.
Exactly. Okay. So the next two questions are kind of tied together. So the first is, can you talk a little bit about THCB, what it is? And then the second part of that is in reference to the THCB question. The unregulated hemp synthetic industry is very silent about the dangers of THCB, correct?
Yes. So, all right. So THCB, the B is in reference to how many carbons are on the side chain. So the molecule of tetrahydrocannabinol has a very distinct ring structure, and then there's what we call a tail that has a standard number of carbons on it. And so, Delta-9 THC, as we know it, has 5 carbons on that side chain. THCB only has 4 carbons on that side chain. So what I think is particularly disturbing about the prevalence of these products is that we don't know what their potency is. We don't know what their effects are. Are they more efficacious or less efficacious than what we know about Delta-9 THC? And so, people don't know how to dose these products. I think what is disturbing is that not only do they not know how to dose it, they don't know what dose they're taking, because you can't necessarily trust the concentration that's on the package's label. I think that the hemp industry being silent about this is because it doesn't behoove them to talk about it, right? Because, the generation of these products, of these alternative cannabinoids, of these synthetic cannabinoids, was to make money. And so I think, the hemp industry being silent is not surprising. I think the medical marijuana community, and, that is regulated in so many states, they are very vocal about it. And that is because that they see the hemp industry skirting, quality assurance of their products and transparency of their products. So, so there are multiple layers of issues around these products.
Definitely. All right. So the next one is an interesting question about, the vape pens in the landfill. So do you have any concerns about the public health crisis being created down the road by these vape pens going to waste in landfill to pollute soil, water, etc.?
I think
The questioner says currently there's no recycling options for those.
Right. Yeah. So there's, again, a couple of, it's a good question. There's a couple of concerns around that, not the least of which is that they contain batteries, and, we are, if, the environmentally conscious, dispose of their batteries by recycling them in appropriate centers. So, so one concern is certainly that you've got lots of batteries, hitting landfills. And then, the plastics, of course, are concerning. So I don't know. I mean, I think you could talk to your recycling center about how to dispose of these in a proper fashion. Having, I think, conversations with frankly with your local government in terms of how to handle it, I think is an appropriate question to have if you're really concerned about it, particularly with the influx of the disposable electronic cigarettes now. So, I don't want to make light of it, but I do think that, if you're concerned, I think we're all empowered or should feel empowered to go speak to, our local government agencies in terms of, hey, can we have a more responsible way of disposing of these products?
Yeah. So I'm going to skip down a little bit to maybe a more practical question do you have any tips or guidance for opening the cartridges when the material is not easily accessed? And I'm assuming this is for analysis.
Yeah, I'll be honest, we struggle as well opening some of the devices. Because one of the evaluations we do in the lab is to try to determine whether or not any particular device can, if somebody can open it up easily to put another drug into it. And so along the way, if we struggle opening it, then, probably somebody else is going to struggle opening it. It's probably going to be less likely for them to put another substance in there. And so it depends on the device. We've opened hundreds of different kinds of devices, and there are some that, that we just have to put a plastic weigh boat under them to catch it, because as soon as you open it up, the entire electronic cigarette collapses. So, so they are particularly challenging, but it certainly depends on the type of what the device is. I don't have a really succinct answer to how to do it.
Okay, so we only have about 1 minute left. Really quickly, do you remember where you read the story or saw the story about the FDA regulation?
Yeah, I think it was on CNN this morning.
Okay. Great. So unfortunately, we didn't get to all your questions, and we didn't get to respond to all of your comments. But please feel free to reach out to our presenter for additional information, or if we did not have time for your particular question. And thank you so much for attending, and thank you, Dr. Peace, for being here with us today.
No, thank you. I appreciate it.
Before you leave today's webinar, I'd like to draw your attention to our feedback form. It takes less than 5 minutes to complete and can be accessed via the checkbox icon directly above the chat. Your honest feedback is invaluable as we continually search for ways to improve and provide the best experience possible. Lastly, across the top of the live stream window are links to our social media profiles, including Twitter, LinkedIn, and Facebook. There is also a link to the FTCOE website, the Just Science podcast, and the FTCOE newsletter registration. Like, follow, or subscribe to stay up to date with everything the FTCOE is doing in support of the forensic community. Thank you again for attending, and we hope everyone has a great day.